short, but really wanted to talk to you about the neurorehabilitation approaches in dystonia. This morning, this afternoon, when we started our session, we discussed like the neurophysical therapist, what to look, what to ask, but also want to talk about what specifically is neurorehabilitation in dystonia. So y'all know me. It's just like I am the neurophysical therapist, licensed in California, Washington, and also do my teaching work at UCSF and on board with APDA. So first and foremost, it's really important that we understand dystonia. Like right now, we were just going over like the functional dystonia, but even in um idiopathic or just the nature of dystonia in itself, there is a lot of network changes happening based on the emerging research study. And it just tells us there is like dystonia is a neural network disorder along with the changes, other changes happening. So there is an interplay of multiple brain structures in the brain. It just gives us the wide window to work on new novel uh, treatments, right from medical interventions to neurorehabilitation intervention. It tells us like it's not just one a specific region or changes which we are seeing, but we are seeing the changes as a whole in the network disorder. So that is something which we feel will be very helpful in the training, both in the medical and the rehabilitation side. So the other thing which I wanted to talk about is regarding the changes in the sensory motor processing. So there has been like multiple studies done, and especially the studies done by Nancy Bill. She talked about like the changes in the sensory inputs. There has been some discrepancies in the processing of the sensory input, which resulted in changes in the motor output and increase in involuntary muscle contractions. This is really important to know because that helps us understand what to look for, how to assess the sensory, visual, vestibular network changes, and look into the processing and the motor output, which which is one of the ways dystonia is manifested, right? Increase excessive movements in one direction. Also, we were briefly talking about the sensory trick. There has been a lot of evidence indicating that sensory trick can influence the brain activation, leading to improved motor command efficiency. Many times majority you have noted like you have a certain sensory trick which works and which really helps you optimize your movement, which helps you better perform the motor output. So that just tells us more in regarding like how the sensory trick works, how do they activate different parts of the brain, and how can we use it for our training purpose, like just for the neuro training purpose. So this is like a nice little uh, picture of different aspects of dystonia, sensory aspects. So the sensory trick is mainly where the sensory input helps you temporarily correct the changes in posture. So this gives a good snapshot of how the sensory trick works. Moving ahead, looking into the neurorehabilitation approaches. So it's really important that neurorehabilitation approaches is way different than just regular neuro or physical therapy approaches in this. It's mainly because we focus a lot on understanding, firstly, the motor aspect of dystonia, non-motor aspect, assessing it, looking into different treatment interventions, right from movement practice, movement training, neuromodulation, sensory reorganization, and more. So I'll just quickly go over the dystonia care program. We've been working, researching, and delivering this dystonia care program for last 3 years. The program is designed in a way it helps individual as a whole. It's a very personalized and evidence-based program, primarily labeled as dystonia care program for cervical dystonia or focal dystonia, like runner's dystonia, hand dystonia. So before starting the program, we make sure we have a thorough assessment, looking at all different system of the individuals, how the motor system, how the sensory system, autonomic nervous system, muscle strength, lifestyle aspect, all of these interact and how do they perform. And based on that, we get started, based on the goals, based on the resources, based on individuals' readiness to get going. We get started with this four-phase program. The phases are divided just to help individual mm, be a be better engaged with it and gradually expand to different stages of this program. Sorry, I was just trying to mute here. So, first and foremost, it's really important looking into the readiness for the change and commitment to participate in the dystonia program. We do focus a lot on the preparation by just getting a thorough assessment, standardized testing, emphasizing a lot on priming the nervous system to learn. The training the brain is the key phase where we focus a lot on sensory motor training, graded exposure, normal movement pattern training, um, gradual progression of different activities. And towards the end phase, we also start looking into treating the underlying factors, including changes in the nerve tension, strength, flexibility. And towards the end, it's more focused on returning back to the community activity, restoring targeting specific skills with minimal abnormal movements. The big goal with this program is to help individuals return to the prior level of activities, decrease in involuntary movements, decrease overexcitation of the nervous system, enhance accuracy of sensory discrimination, and improve voluntary control and restore task-specific performance. So quickly, I'll talk about like the stages. So this is the phase one where we emphasize a lot on priming the nervous system. We really focus a lot on the mind body training. So the week one is focusing on how do we emphasize on autonomic toning to prime the nervous system to enhance brain's ability to make better connection and get ready for this movement training. Um, when it comes to imagining and integrating the phase two sensory motor training, we use wide range of approaches, tools, sensory tools, um, along with graded motor imagery, where we use it's like a brain-based treatment targeting different activation of different brain regions, and also coupled with sensory training. This is a good example. Like this, the individual was uh, having hand dystonia, difficulty holding the pen just because of the hand dystonia. So we had this different setup to help individual use different grasp, different grips in order to continue with the training and explore movements in different ways. Same thing with dystonia. We use different sensory motor training setups, right from the charting which you see out here, and we see how it works right for in different environments, and we try to implement it accordingly. Same here, changing position, emphasizing the use of functional movement, task-specific training, retraining normal movement, for hand dystonia using different mm, textures, soap, seeing how can we use different sensory cues and motor training to combine together. The end is the key important phase. Towards the end, we focus a lot on helping individuals return back to their advanced level, get them back to the community, doing community activities which they've been looking to get to, and just helping them get more independent in their daily routine. Uh, it was really fast forward. I didn't had much time, so couldn't talk more in detail. But really want to emphasize about rewiring rhythm to facilitate normal movement pattern has been the key focus of our work at Beyond Rehab. And we've been focusing a lot specifically on translating the new research, applying the clinical evidence, and creating a unique plan which helps individuals reconnect, retrain, and re engage. Individuals in different stages with different underlying conditions have worked really hard and worked with the team, not just one individual, but worked together with the team and have had really successful outcome in better managing their condition. So there has been more and more research supporting the neurorehabilitation training in dystonia. And also, one of the questions which keeps coming, can this be provided all virtually, right? Like, because our practice is all virtually. There has been a lot of research published in the International Journal highlighting how the remote therapy is effective. And also, more and more research is coming out supporting the telerehabilitation for movement disorder patients, including dystonia and other conditions. Just wanted to quickly talk about one of the case study of a dancer who had dystonia and couldn't get back to dancing. So this was our way of meeting, engaging in a virtual setting. And we started during the week two in different position. We were just working on doing the motor training in lying down position on stomach. And then towards the end of week 12, the individual with the cervical dystonia, she had uh, achieved the good balance of balancing the weighted ball on the top and continuing with her dance movements. So that was the power of training, neuroplasticity, which she had achieved, and now she's back and keeping up with her routine and professional dancing career. Also, last year we presented at Movement Disorder Conference, international conference, just talking about the dystonia care program, a group-based approach. Uh, and the focus was a 4 weeks long virtual program. It was divided into 8 sessions with prior assessment and post assessment towards the end. And it was done in a group setting for 8 sessions for 4 weeks, twice a week. And what we noted, it was funded by the National Spasmodic Torticollis Association, and there was a impact on significant improvement in quality of life, daily activities, and self-management for 8 participants for the group. Um, and the key outcomes was overall enhanced confidence in symptom management, reduced reliance on over-the-counter medication, and effective educational and physical intervention. And this was presented and discussed further. I'll really welcome you to join this 101 course. It's free for all. It just talks more in detail how the neuro rehab approaches to dystonia work. So you can sign up and learn more about it. I can also add it into the link post or just the follow-up email. So I would like you to look into dystonia differently, just as you're approaching and connecting with different therapists on understanding what the treatment looks like, what their background is, if they are the right match for you. Also, make sure like you're having an opportunity to create a tracking plan with your therapist where you're assessing your goals, tracking, communicating your goals with the other team members as well. And also make sure like when you're getting your Botox intervention, uh, the timing of the neurorehabilitation approaches is like you get to have like roughly 10 days of gap in between post Botox, and see how do you pause it and then resume it back. So make sure like combining Botox intervention is crucial, but also making sure you timely communicate so you can plan it in advance if you are getting one injections in coming months. And it's really important that you continue learning, understanding more and more about dystonia. Being a part of a team-based approach is really important, and finding new toolkits, creating your own toolkit is something which will help you very effectively self-manage your care. Thank you so much. It's been very exciting time. There has been more and more research coming out, just supporting the dystonia practices, clinical care, and it's really effective and important to understand the power of neuroplasticity, and we're just finding ways on how do we promote it in different conditions and get you stronger and healthier. Thank you so much. I'll just stop recording and then we'll just open for Q&A. Thank you.